I'd like to acknowledge the traditional custodians of the land on which I am recording this podcast today, the Gadigal people of the Eora Nation, and recognise their continuing connection to the lands, waters and culture. I pay my respects to their elders of the past, present and emerging. Hello and welcome to Unstressed. My name is Dr. Ron Ehrlich. Now, acupuncture is an area of medicine that we've all heard about, and I must admit, I know very little about. So when I heard of the wonderful guest that I have today, I could not resist in inviting her on to share with us her knowledge in this area. And what I learnt was even more than that. I learnt terms about auricular therapy, well, auricular medicine, auricular referring to ear, the medicine that surrounds the ear. Yes, you'll hear more about that. Posturology, another term I hadn't heard of, although I've certainly been focused on posture. And that was an interesting term and approach as well. And also the work with lasers, which I myself have been using in my practice for some time, but so interesting to hear the latest and the greatest news on that. My guest today is Dr. Im Quah-Smith. She is a medical practitioner and an independent medical researcher with a focus on optimal well-being. She's constantly exploring and refining protocols for improving health outcomes. Dr. Quah-Smith developed her interest in mind-body medicine during her many years in general practice, where she observed the effects of environmental stresses on physical symptomology in patients. In the year 2000, Dr. Quah-Smith subspecialized in medical acupuncture, and she shares that journey with us today. And she is, of course, a fellow of the Australian Medical Acupuncture College. Further acupuncture studies were undertaken in Lyon, France, the home of modern ear acupuncture, or auricular medicine, under Dr. Raphael Nogier. Merging her knowledge on acupuncture in traditional Chinese medicine and her neuroscience study in acupuncture, Im has developed strategies in healing and maintaining well-being in the individual. She holds a master's degree in family medicine, and her PhD was on laser acupuncture in depression, where she expanded the evidence-based use of using functional MRI, magnetic resonance imaging. She shares a lot of that with us today. I hope you enjoyed this conversation I had with Dr. Im Quah-Smith. Welcome to the show, Im.
Thank you, Ron, for inviting me.
Im, it's a pleasure. Listen, I know you've been in practice for a few years now, and there's so much today that I wanted to talk to you about, but I wondered if you might just share with us your professional journey to this point.
Okay, well, in short, I was doing general practice at Linfield in a group practice, and Tim Rebelliard, who was one of the principals, invited me to join him to learn acupuncture at North Shore Hospital. And I looked at him and said, well, what's it good for? Because a lot of people just assume, because I'm Chinese, that I would know all about it. And having grown up here, it was completely foreign to me. And I said, well, if it's going to be good for pain, as Tim promised me will be helpful for the patients, I went along with him. And we both did several weekends in a row, and learned how to run it practically and understand the Chinese medicine aspects behind it. And at that stage, it was very rudimentary back in 1991. It was quite rudimentary in what we know about acupuncture. Now we are up into the cell precursors research and all that, a long way down the track. And I tried it out on my patients in general practice for a couple of years, and I thought, oh, when it works really well. And when it doesn't work, you go, well, what's the point? And I figured I couldn't just follow some cookbook recipe that someone told me I had to do for arthritis or pain or menorrhagia or whatever it is, or insomnia. I need to figure it out for myself, how best I can sort it out. And it was around the second or third year into acupuncture, I realized you have to tailor make this to every individual, and everybody comes to that point when they come and see you with a different set of past history. So you can't just use a one strategy, one template for everything. And that's when I thought I should try to hone my skills and marry it to my scientific mind more by doing a Master of Family Medicine, where I used acupuncture, laser acupuncture in depression actually, as a research project with Monash University.
Yeah,
And
I'm looking forward to hearing.
yes, yeah. So we had excellent findings there, and then I replicated the findings when I did my PhD. And this time around, we not only had the clinical study, we also had the neuroimaging, the functional MRI evidence to show what actually goes on in the brain when you intervene in multimodal depression using laser acupuncture. So that was really good to be able to replicate your experiment and to actually show at the brain level how amazing the correlations are. And I've naturally always been interested in people, counseling, started off with pediatrics and women's health, and you know, the whole thing just grows. It's that's where I am now.
Yes. Well, listen, let's start with acupuncture because, you know, whether you have a Chinese background or not, we all hear a lot about acupuncture for various things. And I wondered if you might just give it to us a sort of a acupuncture 101. How does it work? What's the general concept?
Okay, well, Ron, I think people would expect me at this stage to talk about channels and acupuncture points, but you can read that in so much literature, so many other podcasts with other people. But I come along speaking as a medical acupuncturist, so my skills are medicine, and I've got a good understanding, and I practice principles of traditional Chinese medicine. I've got some Ayurveda behind me as well. And I also now, with thanks to University of New South Wales, have a good understanding of neuroscience. So I almost have a triangulation when I see a new patient. I can see it from different aspects of the patient, and then I home in on the root cause or the origin of the problem and work from there. So I kind of think of myself as you'll laugh at this, human electronics engineer, because when you work as an engineer, you're working in systems biology, you're trying to figure out what went wrong there, what supply situation went missing, supply, demand, delivery, and being able to restore every single one of those aspects. So every cell functions optimally again. And usually when cells go off, it could be because of an infection or a persisting infection. It could be from the shock. It could be from traumatic brain injury, and the old-fashioned way to call TBI is post-traumatic stress. It could be from pure neglect, burning the candle at both ends, eating badly, drinking too much, not getting enough sleep. And of course, with 2020 behind us and the whole COVID experience still pretty much with us and around the world, a collective anxiety. So all these things can disrupt what is going on with the body. And I think not in terms of channels or acupuncture points, I just think of the brain and body communicate with each other in an extremely elegant and in a very interesting, complex electrical wiring kind of way. So we're talking about how it's sort of like a 3D information freeway. So it's not a linear system where point A in the brain talks to B in the body, C down the leg or whatever, and then it goes down E, F, G back up to the brain. It actually is far more complex, more three-dimensional. So everything pretty much happens at once. And I think if you can think of, it's hard to think of an analogy. You might be able to find me one along the conversation piece.
Sure.
So it's like a 3D electrical grid, and we are aiming for optimal signaling between every aspect of the brain and body communicating with each other. And there will be sections of the brain and sections of the body where it's like an interchange. It's like Chatswood interchange if you live in Sydney, or Bondi, eastern suburbs, Bondi interchange, where there's a lot more activity, there's a lot more transport exchanges happening, and those areas have faster response, faster freeway movement. And then out in the periphery, there'll be slower movement, slower communication. But the main aim is to figure out when all these possible insults to the brain and body happen, where the glitches are, or where the traffic jams are, where the short circuits are, and to reestablish it. You can do that with needle acupuncture because we know there's a huge amount of functional MRI and, mostly functional MRI experiments out there, starting with Zhang He Cho back in, I think, 1998, 2000, showing that when you tinker with acupuncture points in the legs, particularly stomach 36 or spleen 6, these points trigger a response in the midbrain. And from there, the signals then go to various parts of the brain which need some readjustment or rehabilitation. And then the signals will then go back down to whichever part of the periphery that needs a correction. So functional MRI has been the most wonderful thing for acupuncture, because before that, everyone was very stuck in spinal cord work and about how it's always about pain pathways. And actually, it's way, way more than that. There's a lot of autonomic nervous system re-regulation. And I think that's even far more important than just spinal cord dorsal column 2 to 5 activation or re-regulation that happens when you do needle acupuncture. When it comes to acupuncture too, there's different modalities. The traditional, of course, is acupuncture needles, which, by the way, aren't sharp. I have to tell the audience, everyone's terrified of being punctured. And it sounds dreadful, but if you look under an electron microscope, the tip of the acupuncture needle is actually round-tipped.
That's
Very
reassuring.
rarely any blood come through unless you're scratching the surface on purpose or bursting a capillary as you pull the needle out in a rough way or something. But it's actually highly elegant. It's a bloodless field. It's non-invasive. And it's really not meant to feel pain. It's meant to feel like a little tweak or a low-grade ache if you're doing it correctly.
Okay.
So for those of you out there terrified of needle acupuncture, please be assured it's not really needling. It's actually round-tipped and it goes through the pores, and it's a very gentle, elegant, refined process.
Oh, it sounds so inviting.
I hope I've convinced you.
You've made that sound so appealing, Im. I can't wait. And I know this is odd, but as a dentist, I have needle phobia. It's one of those things that's better to give than receive. I love your description of yourself as a human electronic engineer, because one of the things that I think we all as health practitioners, let alone as the public, need to be aware of is we are walking electricity.
Absolutely.
We are. Well, that is how anything works, whether we're talking about a single cell or the whole body. It's all micro currents that drive us.
Exactly.
So I love your analogy of this human electronic engineer. I love it. Go on. I'm loving this.
So what else can I share here? Oh, so when you do a treatment, an acupuncture treatment, and you tailor make it for the individual, you will create some of these shifts you require to have a much better signaling between the brain and body and to restore functionality. But the brain is a bit of a lazy pupil. This is my understanding after being a doctor for 40 years and having done acupuncture and laser acupuncture for 20 years. It's a bit of a lazy pupil, and I kind of understand it because we're working with neuroplasticity. And if you want to imprint a signal, you have to do a repeated signal until it consolidates. It's not going to remember. When I do posturology, I'll tell everyone, you'll find your back, your muscles, your head, shoulder thing will improve for probably 1.5, 2 days, then it'll go back to square one. But the more I put in a signal, the more it'll remember for a longer time period. So we need the consolidation. So if people wonder why they have to keep going back for a few sessions, it's because you're trying to consolidate a change in signals. Like learning, here's a good analogy. Like if you're going to take up piano playing, or you're already a good piano player and you're learning a new piece, you're not going to be good at it in the first 1, 2, 3, 4 times. You may get better at it at the 6th time, and certainly by the time you played it 12 times, you'll be pretty good. Not concert pitch, but pretty good.
No. But you were mentioning that there are different modalities, and the I don't even want to call it a needle, the rounded, gentle probe that goes through the pores. We'll
Oh,
call it
yes.
we'll call it needles. Go on, we'll call it needles.
It's
Call it
literally,
needles.
the WHO expects it to be called a
Yeah,
needle.
so that's one modality, but there
Yeah.
are others, aren't there? Well, tell us about
Yeah.
some of the others.
So you can do acupressure. So you're taught how to massage, get the lymphatics in the right direction, or which way you want to move, or to stimulate in whichever direction. And there's a complex, another lecture in itself there. But so acupressure is one. You can put magnets in the ears. This is auricular, which we'll talk about later. You can put magnets on parts of the body, because when you put some sort of a stimulation, whether it's a stimulated electromagnetic field, and if we're all electrically wired, every single electric current would have an EMF, as we know. So when you use magnets on the body, you are actually making a signal change or clearing a signal block or short circuit using the magnet. The other modality that some people use, and certainly in Australia, we use laser acupuncture, which is therapeutic laser. It's helpful. I love using laser because laser helps you quantify how tired an area is, how bad the short circuit is, how dysfunctional a site is, because you can actually quantify it. And people say, well, how can you quantify it? Don't you just put 10 seconds here, 10 seconds there? No, because if you learn something from auricular medicine, and I will say auricular medicine and not therapy, because it's a whole field, standalone. You don't even have to use the word acupuncture. You don't have to be acupuncture trained to use auricular medicine. With auricular medicine, Raphael Noguet, or Paul Noguet, the father of modern auricular medicine in France, discovered this pulse called the vascular autonomic signal, or the VAS. It's sometimes known as the RAC, and there's a whole other sort of names used in Europe, but I think of it as the VAS, and I've done all the research and applied the term VAS or VAS. The vascular autonomic signal is a very peculiar thing that Paul Noguet discovered back in the 50s and 60s, probably the 60s, is that when there's a dysfunction in the area on the body surface, the radial pulse, this is where you can pick it up. You pick it up from any other pulse, the carotid or wherever else, but the easiest one is obviously the radial pulse. When you run your hand along a patient's skin surface, like along the hand, or along a fractured rib area. So here's a classic. I saw a patient today who had a sailing accident and broke 2 ribs. And I didn't need him to tell me anything. I just looked for where he sits on the right side. So I looked on the right side and I correctly located where the 2 fractured 8th and 9th ribs were by using the VAS. So it picks up on a change in electromagnetic field because of our electrical wiring on the surface. And when you have a dysfunction, like a fracture, there will be a shift in the magnetic field. There'll be a shift in the electrical signaling there. And you can use the vascular autonomic signal to pick up the location of it.
And you picked that up by palpating it or with the laser? How did you?
Yeah, no, I just use, this is the vascular autonomic signal. I feel the patient's radial pulse and check its amplitude. And then I scan my hands, touching the skin surface lightly around the area which I think the problem is. And you can then home in precisely on where the rib fracture is. And the patient will say, ouch, you got it, you found it.
Right.
Yeah.
Okay.
Yeah. So the VAS is a wonderful thing, which I think really should be taught in future years, hopefully in medical school. And because it's such a wonderful tool for you to home in on where the problem is. And it's even more relevant when you do auricular medicine as well.
Well, you introduced me to this term,
Yes.
auricular medicine, and I must admit, I'm not familiar with it.
No, it's not. It's not heard of in this country. I trained in France. It's the only reason I'm using it and able to apply it in my research work. Yeah.
So, auricular therapy. Tell us about auricular medicine.
Very good, Ron.
I've already learned that.
Excellent.
Okay, auricular medicine. Tell us about auricular
medicine. Is extremely helpful, and its use is hinged on the fact that the auricular surface on both sides, so left ear works on the left hemisphere of the brain, right ear works on the right hemisphere of the brain, so it's ipsilateral. And the surface of the ear is innervated by the auricular branches of the vagal nerve. So the auricular branches of cranial nerve 10 or the vagal nerve, cranial nerve 5, which is the trigeminal, and the superior cervical chain. All these three things innervate the surface of the ear. And from these areas, cranial nerve, you can then access a whole range of central functions or brain functions by using the ear via cranial nerve 10, which is usually in the concha or the hollow of the ear, or cranial nerve 5, which is all along the helix in the mostly the upper part of the ear, and then the superior cervical changes more further down in closer to the tragic notch where it touches your face, around there, that region. So with the ear, when you use parts of it, and if you use the vascular autonomic signal, you can figure out which part is in trouble. And when you treat that area, which comes positive or an increased radial amplitude using the VAS, you know then you need to either put a magnet there or needle there or laser there. And I'll just elaborate the laser thing a bit. If you use your therapeutic laser and you aim for it, for example, in the concha, there's you'll find with your VAS the exact maximal optimal point to treat to access the cranial nerve 10 entry into the brain. And then if you laser it and you count the laser, as in the patient's pulse, how many seconds it takes for the VAS signal to peter off. So when areas in dysfunction, like for example, the cranial nerve 10 site in the ear, and the pulse will become, because it's in trouble, it becomes more like a sawtooth wave, and you just keep on transferring light energy, your laser beam, into that point, and eventually it'll become a sine wave, and you know you've topped up the region, you've corrected the problem, because most things in synchrony, those things which are running well, is usually a sine wave of sorts, and sawtooth waves are when there's the dysfunctional side. So if it takes 57 seconds to change your radial pulse amplitude and waveform at the ear, then you know your vagal upload time, or your VUTR. And these are things I've coined for myself. I use it a lot, and I've published a couple of papers on that already. It's very interesting because then you know this is the baseline for that particular individual, 57 seconds. For whatever the dysfunction is, let's say it's irritable bowel, or it's post-chemotherapy liver change, which is all vagal linked, and you're trying to restore function. So it took you 57 seconds to rescue, inverted commas, the liver or the cranial nerve 10 affected by the chemotherapy or whatever the issue is, and you've restored it. So then you do whatever you have to do, and then the next time you see them at the next session, it might still be there, or it could be a lot better. Let's say 57-second vagal upload time down to 25. So you know you can quantify they're heading the right direction, because empirically I found you need to get the vagal upload time down to 15 seconds or less to have the perfect vagal functionality. But of course, we're living in difficult times. I've yet to find anyone get down to 10, actually.
And what is, and so your feeling, I mean, whenever I have had acupuncture, and I've always been impressed that the practitioner puts their hand on my radial pulse and says, yes, they can feel this or that. That's the VAS that you're feeling, the vascular.
I'm feeling a singular VAS, because the Chinese pulse involves six pulses each wrist, which I do measure that too, but I'm looking at a wavelength change.
Right.
Yeah.
And it say might take 57 seconds for you to correct that.
That's pretty bad. Yeah.
I was going to say, what is the range that you've seen clinically?
Could be huge. Like I have a patient I saw earlier this year, and what was she? She was early pulmonary fibrosis. So I need to step back there and say, so the ear, apart from the concha being access to cranial nerve 10 and cranial 5, all the other parts of the ear, there's also a map of the ear, which I know it's going to be uncomfortable, anyone with a medical degree to believe that the ear actually has a map of every single organ in the body, including the earlobe being the neocortex, and at the intertracheal notch, that region is actually the subcortical region of your brain. But there are a few functional MRI and other neuroimaging studies to show brainstem. They have been able to represent brainstem, the body parts like knees, using MRI, stimulating, and then picturing it and realizing that it actually goes to that part of the representation in the somatotope in the brain department. So they've been able to, the French have shown knee areas and hands areas, and the Italians have been able to show brainstem region. And of course, my colleague and friend, Richard Nimzau, at Andrews Air Base, runs an acupuncture clinic, and he's world famous for battlefield acupuncture. He uses it as battlefield acupuncture, but I tend to think of it as standalone auricular medicine, because the battlefield acupuncture he uses includes cingulate and thalamus at the ear. It includes sort of a physiological resetting point in the ear, 5 points that you use called BFA, battlefield acupuncture. Then he uses studs, he punctures studs in. What he did was he designed this protocol, BFA, battlefield acupuncture, for all the servicemen, the military who were injured in battle in Afghanistan and Iraq, so that the medic on the team can get up to the person who's injured, shot, IED explosion, something nasty like that, being able to punch in battlefield acupuncture points. And then by doing that bilaterally, it was central pain control immediately.
Wow.
Central pain control.
Wow.
So enough that they can pull the guy out of the danger without him being in massive pain, and the soldiers know it for themselves. And So that,
I mean, literally battlefield acupuncture. I thought it was a metaphor, but it's not. It's literally a battlefield. Wow.
Am I allowed to go aside and tell you an interesting story?
Of course you are. Of course you're allowed to.
Okay. So I was very fortunate that Richard Nimzau then invited me the year after I finished my PhD to go to Korea, where Professor Zhang He-Chu, who discovered the beginnings of how acupuncture works at the brain. So Zhang He actually started his huge professorial career at University of California, Irvine, in the Neuroimaging Institute there. He did a lot of his original. He's the father of PET scan, by the way. Zhang He-Chu is a delightful, very gracious guy, very humble. And he did a lot of his neuroimaging PhD at Karolinska in Sweden. So he's very well traveled, very knowledgeable. So Richard rang me and said, how would you like to come to Korea with me and let us work out how battlefield acupuncture works at the brain level? I mean, I've just finished a neuroimaging PhD, and I went, what? I said, can I? I am so chuffed. Oh, yes, please. So I cleared my books and created the space for a week. And off I went to Korea, and I met up with Zhang He-Chu, who I've met before because he's come to teach us about neuroimaging evidence for acupuncture in Australia for the Australian Medical Acupuncture College a long time ago. So I've already met him, and he remembered me, and Richard was there. So we then did an informal experiment because we were just curious to see, was apples and lemons, or are we talking, I mean, we're just kidding ourselves. And once again, the scientific element comes in.
Hang on, I lost you there.
So we managed that. Oh.
I lost you there just for a few seconds. Tell me when to speak again. That's right. No, you're right. Yep.
Okay. Go on. So we Zhang He was based at Incheon University Neuroimaging Institute at that time, and we got some volunteers, his postdoc and doctoral students, to volunteer their ears, and I volunteered myself because I want to be convinced that this battlefield acupuncture did actually manage to reduce pain centrally. So what we did was we had this experiment where we had water up to 52, 55 Celsius. When we put your fingers into it, your hands will go pink and quite raw and uncomfortable. So then you would go, oh yes, it's 8 out of 10 hot or 10 out of 10 very hot or something like that. So we had a baseline measure, and then we had the needles put in, which were compatible inside a magnet. And then we got in there and we got our brain scanned. And then while we're in there, we kept on dunking our fingers into this water, this beaker of 55 Celsius, and we would then be gauging, I think it's about 3 out of 10. So the hot water, even though your hand looks like it's burned, felt like a 2 out of 10 or a 1 out of 10.
Wow. Wow.
So I knew it worked because my hand looked terrible, but I didn't feel the pain anymore. So that was quite amazing.
Yeah. You alluded to the fact that when a medical trained doctor looks at a chart which shows the ear in all sorts of different parts of the body, this is met with skepticism.
Absolutely. I started my acupuncture career with great skepticism myself. You have to start there. And then sort of write the experiment. And sometimes if it doesn't show, it's because you probably didn't have the right design or you didn't grasp what you're trying to measure. I think that's the main thing.
Yes.
And the other thing I learned as a researcher is never leave any stone unturned. Just because there's no evidence now doesn't mean in the future someone will not find it for you.
Yes, yes. Well, when you talk about research, I know you did your PhD in neuroscience and laser acupuncture.
Yes.
Can you tell us a bit more about your findings there?
Okay. So in our laser acupuncture and depression project, we ran concurrently a clinical study. So I selected points which were relevant to depression in the traditional Chinese medicine sense. And they were similar to the ones that I used when I did the Monash project. And we lasered and we had the laser rigged up so that you can't tell whether it's real or fake laser. You just hear the beeping, you see the white light, but the white light's just a pointer light. It's actually not the laser at all. The laser is infrared, so you can't really tell what's what. And we lasered all these depression-friendly points on the participants twice a week for 4 weeks and then once a week for another 4 weeks. And we made sure that we got the right Hamilton D scale for depression, that they were all in that range. And at the end, and then we took readings. So the research assistant took readings in between as well. So we made sure we had self-rated scales, and we had to make sure there was a clinician rated scale as well at the beginning and the end. So we wanted to be absolutely watertight and not miss anything, because one of the things is it's better to measure many more things and then find what you want than to miss out and think, oh, we should have measured that, and it's too late by then. You finished your project and you've missed out measuring something important. So we found that it was highly significant using these acupuncture points for mild to moderate depression. And the results correlated with the neuroimaging that we did as well for mild to moderate depression. And because there were quite different findings to that from people who were just controls and not depressed at all.
I mean, it's not actually surprising, although I haven't thought of it before, that acupuncture could be used in a positive way to deal with depression. Because we talk about the mind-body connection here, and it's all, we kind of compartmentalize all these things as though they're separate. But this is again about restoring function, restoring balance.
So the interesting thing is that neuroscience and acupuncture are actually just two languages describing the same physiological phenomena. For example, in acupuncture, you say someone is in excess, or someone's deficient, or your liver's in excess, your liver's deficient, so I've got to fix it up with my needle acupuncture or whatever. And when you're talking functional MRI activity or how the brain is going, when someone is in excess, many areas of the brain are in activation mode. And when they're deficient, you can see the underactivation happen. You put in your intervention for whatever times you have to do it, and then you remeasure it, and you'll see that that whole overactivation, crazy fireworks in the brain picture becomes very calm and normal again. Yeah. Or if it's dysfunctional or underactivated or deficient, you find there's a lot of underactivated areas, and I won't go into the the science and the colors and all that. And then when what happens is with the laser acupuncture and with needle acupuncture, I'm sure, you'll find that the underactivation goes back to normal. So acupuncture per se, and even auricular medicine per se, what they do is they tend to correct whatever this dysfunction is. It causes a re-regulation, and everything's about restoring optimal function best possible. Obviously, there's other comorbidities, whatever else, so you have to put in the best possible. Yeah.
And the lasers that we're talking about, they are low energy?
They're therapeutic lasers, so majority of people would have infrared wavelengths, and other people would have red light laser. The other lasers, yellow laser and all that, are very expensive and hard to find. So what you find that people get access to for clinical care would be infrareds and red light lasers.
And is that wavelength particularly important? Like, is it a very narrow, well, the infrared
wavelengths
is,
are quite important. The wavelengths are not so important when you're doing brain work, when you're doing auricular medicine, but if you're doing body work and you're trying to get into a really spasmed muscle, infrared would be better because it penetrates deeper. Red light doesn't penetrate as much. That's about the only take-home message you need to know about that.
Yeah. I remember using my first low energy laser in about 1990, and I remember that it was said the reason it worked well was because it A, improved lymphatic drainage, and B, improved mitochondrial activity. And when you say to me you're an electronic engineer and mitochondria is where the electron transport,
that would
the
be
whole
at the
energy.
Yeah, exactly. So that would be at the micro level. I started getting interested in mitochondrial medicine in February last year when I was with one of my teachers, Michael Weber, who's a fantastic expert on mitochondrial medicine. I was actually ahead of the COVID in beautiful Caballero, Algarve, when we had a week's worth of mitochondrial medicine workshop, and I learned so much there. And that goes into a field that will take another lifetime to learn, which is, what supplements do you use, etc. I won't even go there. I'll leave it to the experts. I will stick to my skill set.
Now, another term that I learned when I was looking forward to talking to you about auricular medicine and your research around acupuncture and laser was posturology. Posturology was another word that I was not familiar with. Tell us a little bit about what that means. What is posturology?
So posturology is using auricular medicine at the ear and accessing the areas which connect, which then link to the brain department, which is in charge of making sure your whole frame, your head and your torso and your hips and your legs are all matched up, so you have the same equal pressure landing on the left leg and the right leg as you stand on the ground. So equal muscular tension as opposed to one side being tighter or rotated. So posturology, repeated action, usually half a dozen sessions, is enough to correct that postural change. So anything can go wrong when you have muscles in the back and neck not behaving properly, because we have to remind ourselves the autonomic nervous system sits outside the spinal cord, outside the protection of the vertebrae. It's just sitting just a bit outside. The paravertebral muscles are just overlying it. So if the muscles are tight, they can definitely irritate the autonomic ganglia and can create a plethora of symptomatology, anything from palpitations, panic attacks, anxiety, dizzy turns, butterflies in the stomach, nausea, anorexia, you name it. All these very vagal things. Think of all the vagal symptomatology, and they all will activate because you are irritating the autonomic chain wherever the issue is. Yeah.
Mm.
So posturology, when you correct the muscular structures, you just help this autonomic system to behave the way they're meant to behave and to run the body as they should be running the body without any irritation at any time point. A classic spot is up here. It's paravertebral C7, T1. At T1, about an inch out, you have the stellate ganglion there. And I learned this from in France with Raphael Noger. And when you correct the posture, you're relieving the tension, which is such a classic place. Everyone holds their tension and stress up there, particularly when you've been Zoom working from home in dining room chairs and not proper chairs or normal workstation. So you can then create all those vagal symptomatology I just mentioned by having this problem there. So posturology just corrects that.
Mm. Well, you should try being a dentist, Im, and
Yes.
that point is, I can
Yeah,
relate to that. But
constantly.
how do
Yeah.
you assess that? Is that just by observation, palpation, or is it actually on a
Oh,
on a?
there's a range of things. It's hard to explain on a podcast, but you just get patient to stand and
And
you work
assess it?
out. You have to observe and see and make an idea
Yeah.
what the differential is, and you record it. And then I have to tell you, when you do the posture points and you then 10 minutes later stand them and measure it again, it's corrected. Then of course
Mm-hmm.
you got to consolidate. It's going to be good posture for 1.5 days, then it's going to be bad again. Bad habits come back. Yeah. So you neuroplasticity is the most wonderful thing. It just works so quickly. You just have to consolidate the positive changes. Yeah,
Yes.
that's my experience.
And that consolidation, as you were mentioning with the learning of a piano piece or the correcting of a body electric
Yeah.
system, takes, you're saying 6, 10, 12 sessions.
For the majority of people, it would take about 6 sessions, unless they've got a lot of comorbidities, and it could be any other reasons why the muscles aren't restoring their function as quickly as they should have. Yeah, 6 is a very biological number. You sort of read some physiotherapy studies or acupuncture studies or auricular, and you find that 6 is, I'm not sure why, no one's ever explained to me why 6 is the turning point.
It's
Of
true.
course,
It's true.
have you noticed this for
I
yourself?
have. I'm
I
very
don't know.
familiar.
Someone needs to do a study why 6 is the magical number.
Yes,
It's
I
the
know.
turning point.
Yes, it may be when we run out of fingers on one hand and we're committed to, expanding our frame of reference.
Yeah.
Another term that you used is somatization.
Somatization. Yeah.
Somatization.
Somatization.
Tell us about that. Explain
Yeah.
somatization.
Somatization is everywhere. All it means is that when your brain is in dysfunction, particularly the emotional part of the brain, it will then, through its midbrain section or the limbic system where physical and emotional pain sit together, your emotional pain turns into a physical pain and will go to some body part. So, for example, frozen shoulders or shoulder stuff. Sure, you can have a shoulder injury, and then, of course, you get problems, and that has to be treated as a shoulder injury. But sometimes, if it doesn't repair as fast as the consultant or the physiotherapist expects it to, or the osteopath expects it to repair or be back to normal function, it's because there's some sort of a somatic element there hiding. The shoulder it's like at least 70% muscular structures, and muscles hold a lot of emotion. Just like it's like wearing your heart on your sleeve, So it's like wearing your heart on your muscular fibers is exactly what this is happening. And when you have a lot of worry, when you have some emotional distress, the shoulder will always have some dysfunction, whereas you can't move it, or it's stiff, or it's painful at night, or you can't turn it into, get the hip pocket or get out your wallet or whatever it is. All these things, and it tends to be more lateral and posterior. In a small percentage, it could be more pectoral as well. Then you got to consider cardiac things and all that kind of stuff. So that's what somatization is when it comes to the shoulder. So it tends to be more worry, preoccupation for a long, long, long period of time, and emotional distress. When people get the sciatica syndrome, not true sciatic, which is very rare to get a true sciatic. That's why it should be a sciatic syndrome, because it's not really it's not nothing to do with the sciatic nerve. It's about the the flank muscles, the quadratus lumborum, the gluteal muscles being really tight, really spasm. And this whole area involves a whole different dynamic, a whole different set of electrics. And that's more about internalizing major frustration, major anger or wrath. Yeah.
Okay.
So,
Interesting. So
yeah.
listen, we've covered a lot of territory here, and I think you've certainly whetted our appetite for all of these: acupuncture, auricular therapy, posturology. Taking a step back, because we're just going to finish up now, and I just
Yeah.
wanted to take a step back because we're all on a journey together in our life through this in this modern world. I wonder what you would say is the biggest challenge for an individual on that journey.
Yeah. I pondered about this, especially last year, actually, with COVID, and are we going to become like Italy and France with 800 people dying a day? So I think the most important thing is to do what it takes to get yourself more resilient. And certainly when I do auricular medicine, I'm constantly improving people's resilience because I'm working at the brain department. But what you can do is meditation. Meditation is a wonderful tool. It doesn't have to be sitting down for an hour, lotus position on the floor or something like that. All it needs is 10, 15 minutes a day of meditation, because meditation immediately goes to your midbrain and then it activates every single corner of the brain to tidy up, and then all those wonderful positive change then goes down your spinal cord, down your autonomic nervous system chain to the rest of the body. And it's a wonderful way. Every day when you meditate, you are re-regulating your autonomic nervous system, taking away the stress, restoring function, doing that little bit of housekeeping. So you don't ever go too far left field or too far right field, and then you have a shock or a nasty infection, and then you find you can't recover, or it takes you way longer to recover. So I think working on meditation, a good diet is really important. And I think the one other thing I think is important that people are starting to realize is significant is getting good quality sleep. That isn't stressed enough, I think, in this modern world. And with the plethora of devices and watching Netflix at 1 or 2 o'clock with the binge movies or whatever it is series, people are losing their sleep patterns. It's good to get into good sleep habits, get good sleep patterns, because physiologically, when you sleep at night is when your body repairs, when the cells are repaired, and when your cells are replaced. And if you're not sleeping deeply between 1 and 5 o'clock in the morning, particularly, you're not going to get any of that repair happening. So resilience and looking after yourself so your body just hums along.
Well, Im,
that's my take.
That's a wonderful piece of advice, and I want to thank you so much for joining us today and sharing
Thank you, Ron, for inviting me.
your wisdom today. Thank you so much.
Thank you. Bye.
I love that description that Im gives of herself as a human electronic engineer, because that is really what we need. We are walking electricity, where every nerve in our body works on electrical currents. Every cell, as it moves things in and out of the cell, works on differentials of electrical potential and microcurrents. So her being a human electronic engineer and feeling that, what did she call it? The vascular autonomic system, the VAS, the vascular autonomic system, is what she's feeling for, that energy flow through the body, and the resetting, the re-regulation of the autonomic nervous system, which is basically what regulates our whole body. I mean, if you look at our whole nervous system, when I lift my hand up to my head, that's my peripheral nervous system relaying a message from my brain down my spine to the muscles, which lift my hand up to my head. But so much more of our neurology, I think it's something like 70 or 80% of our body's neurology is the autonomic nervous system, which is just constantly working there in the background and regulating all that goes on. And we talked about heart rate variability. I'm reading a book on polyvagal theory, which is a whole new approach to, or a novel approach to how we deal with stress. Im was talking about 3 cranial nerves there. The 10th cranial nerve, which is the vagus nerve. She was talking about the superior cervical nerve, and also the trigeminal nerve, which is the fifth cranial nerve. So these are all very connected to the ear or the auricular area there, and that is what the focus is on, a way of reading dysfunction or dysregulation of the nervous system and a way of restoring it. And I thought also Im's parting comments to us about building resilience is really what this program is all about. It's about identifying and minimizing the stresses in life that cause autonomic neural dysregulation or chronic inflammation, or you may hear the word cytokine storm. These are all presentations of similar things. And on the other hand, building resilience by focusing on the 5 pillars of health: sleep, breathe, nourish, move, and think. And we have a wonderful online program coming in the second half of this year, which I would encourage you to click onto and become part of that community and that program. Look, I hope this finds you well. We'll have links to Dr. Im Quah-Smith's practice and her resources on her website, and so much of her research around auricular therapy, low energy laser therapy, acupuncture, and posturology. She's got so many wonderful resources on her site, which we'll have all links to. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.